Health officials in China are racing to contain a massive outbreak of chikungunya. This is a mosquito-borne virus that can cause severe pain. 7,000 people have now been infected. A campaign is underway there to stop further spread of this virus. CBC's Angie Seth has the details.
The chikungunya virus has infected approximately 240,000 people in about 16 countries, and there have been 90 deaths. However, no cases in Canada, and Canadian officials are monitoring things carefully. But there are outbreaks to note of. As you can see on the map there are areas of concern. So we're looking at regions around the Indian Ocean. So that includes, as you can see on the map there, Réunion, Mayotte, Mauritius, Madagascar, Kenya, and Somalia, as well as Bolivia, China, and Sri Lanka. We're going to shift our focus to China. That's the area of concern as well. Over 8,000 or so cases there centered around the Chinese province of Guangdong, as well as the southern city of Foshan. Those that have been infected in those areas have been quarantined in hospital until they have a negative test for the virus. And this virus, in terms of symptoms, can cause fever and joint pain. In some cases, that pain can be severe. It apparently does start in the hands and the feet, but it can spread to other parts of the body, and the pain can even last several months. Other symptoms include a rash, fatigue, headache, nausea, and vomiting, and those symptoms can take up to a week or so to appear after an individual has been infected. What is important to note is that this virus is spread by infected mosquitoes, not person to person, so that is an important distinction. Here's more on that.
And in many places, we don't control the mosquito population, so the likelihood is that once it gets from, say, someone who has traveled to China and then, say, back to Singapore or anywhere else, and if they do encounter mosquitoes, it would not be of any surprise that there will be outbreaks that spring up all over Asia, Southeast Asia, and many other parts of the world.
So again, no cases in Canada, but officials are monitoring things carefully. Now, people at higher risk include newborns or infants under the age of a year old, older adults, and those carrying underlying medical conditions. Pregnant women are also an area of concern, and those pregnant women can also pass the virus on to their babies inside the womb. Canada has issued a level 2 travel advisory to those places of concern. And what that means is that they're advising travelers to practice enhanced health precautions. Use, for example, approved bug spray or insect repellent on exposed skin, to also encouraging people to wear light-colored, loose clothing made of materials like nylon or polyester, to wear socks and closed-toe shoes, as well as to sleep under a mosquito netting if you're outdoors or you're staying in places that are not fully enclosed. There is also a vaccine for this virus for prevention, and it is approved in Canada. People are being advised to go to the Canada government website under travel for more information, as well as to get those latest updates. Angie Seth, CBC News, Toronto.